Can scoliosis really be fixed without surgery? It's one of the most common questions I get. Whether I'm speaking to a worried parent, an adult dealing with back pain, or even other health professionals. And I get it. When you hear the word scoliosis, the first thing that often comes to mind is surgery. It sounds scary, and it leaves a lot of people feeling helpless. But the good news, surgery is not the only option. In fact, for many people, it's not even the best option. I'm Dr. Juan du Plessis, Clinical Director here at ScoliCare. I work with patients, families, and clinicians worldwide who want to manage scoliosis pain without jumping straight to surgery or waiting until it's too late. And today, I want to help you understand what's truly possible when it comes to treating scoliosis. Because once you understand what non-surgical treatment actually means, you can make clearer, more confident decisions for yourself and your child. The biggest problem here is confusion. People hear the word fix and assume it means one thing, like snapping the spines perfectly straight again, as if scoliosis can just be erased. On the other hand, some are told that nothing can be done at all, unless the curve gets so severe that surgery becomes the only option. So we end up with two extremes, false hope on one side and unnecessary fear on the other. That's why this conversation is so important, because fixing scoliosis, it doesn't mean what most people think it means. Let me paint you a picture. Your 13-year-old child just had a routine checkup and the doctor says she's got scoliosis. It's mild, maybe a 20-degree curve. You're told to keep an eye on it. That's it. So you go home and you start Googling, and suddenly you're drowning in conflicting advice. One article says, don't worry, most cases don't progress. Another warns, if it gets worse, surgery might be your only option. And in between, you find people arguing about braces, exercises, whether they work, whether they don't, and you totally feel stuck. You want to do something, but you're scared of doing the wrong thing. And somewhere deep down, you're wondering, is there any way to actually fix this? Or are we just waiting and hoping that it doesn't get worse? That moment of uncertainty, of urgency, is exactly why this conversation matters. Because the earlier you understand what's really possible, the more options you have. So, what is possible in scoliosis? To answer that question, can scoliosis really be fixed without surgery? We need to first agree on what fixing actually means in scoliosis care. If by fixed you mean the curve disappears completely and the spine becomes perfectly straight forever, then no, that's not how scoliosis works. But that doesn't mean we're stuck. Scoliosis can be managed. In many cases, it can even improve. We can reduce the curve, stop it from getting worse, improve posture and function, and help someone live with less pain and more confidence. And we can often do all of that without surgery. So no, it may not be fixed in the way people imagine, but there's a lot that we can do. Once you understand what's possible and what outcomes we're actually working toward, things become a whole lot clearer. All right, so let's talk about what fixing scoliosis really looks like and why non-surgical treatment can actually help. First, we have to understand what we're aiming for. In scoliosis care, the goal isn't always to make the spine perfectly straight. That's not realistic, and it's not necessary to get good outcomes. Instead, we talk about curve reduction, slowing or stopping progression, and improving the patient's overall posture, function, and quality of life. Now, can non-surgical treatment actually reduce the curve? Well, in many cases, yes. And I'm not just saying that based on personal experience. There's research showing that with the right combination of custom-designed brace and specific rehab exercise, we can see measurable improvements in spinal alignment. This isn't a one-size-fits-all bracing either. At ScoliCare, we use the ScoliBrace, which is 3D designed for patients' unique curve, posture, and body shape. And we combine it with our movement-based program, ScoliBalance, which helps retrain posture and control through guided exercises. But of course, it's not magic. Success depends on a few key factors. Age does matter. Younger patients who are still growing often respond better and faster. Curve severity is important. Milder curves are more flexible and easier to influence. And finally, compliance. That means wearing the brace as prescribed, doing the ScoliBalance exercises, and committing to the process. So no, scoliosis can't be fixed in the sense of being erased, but it can be treated. It can be improved. And for many people, that means better posture, fewer symptoms, and a lower risk of progression. So, what do you do with this information? Where does this leave us? If you or your child has scoliosis and you're wondering whether non-surgical care is a viable path, let me show you what to look for and how to take the first steps. So now that you understand what fixing really means and how non-surgical methods like bracing and rehab can lead to real correction, the next question is, how do you know if it's the right option for you or for your child? Because this isn't just theory, this is something you can take action on. And the earlier you do, the better the chances of a positive outcome. So let's look at how to get started, step by step. Step 1 is getting a proper assessment. Not all scoliosis cases are the same, and not all curves need the same kind of care. That means high quality x-rays, a full clinical exam, and an expert interpretation, not just someone glancing at the curve angle. You need a scoliosis clinician who understands how to read the full picture, not just a number. Step 2 is to explore customized treatment options. That's where solutions like the ScoliBrace come in. It's not off the shelf. It's not generic. It's a 3D designed using advanced software and tailored to fit your body, your curve, and your posture goals. The difference in results compared to generic braces, night and day. Step 3 is to pair the brace with active rehab. This is where ScoliBalance comes into play. These aren't random exercises, they're targeted movements designed to help your body build control, symmetry, and strength in a way that supports long-term correction. And finally, step 4 is consistency. I won't sugarcoat this. The best treatment plan in the world won't work if it's not followed. That means wearing the brace as prescribed, doing the exercises regularly, and tracking progress with your care team. When all of that comes together, the assessment, the custom design, the active rehab, and the consistency, non-surgical correction becomes not just possible, but powerful. So if you've been wondering what your options for scoliosis are without surgery, I hope this has given you a clearer answer. Because the truth is, there's a lot more hope and a lot more science behind non-surgical correction than most people realize. And now that you know what's possible and what steps to take, you're in a much stronger position to make the right decision for yourself or your loved one. So let's pull everything together. So where does that leave us? Scoliosis isn't something we fix like a broken bone. It's a complex condition, and while we may not make the spine perfectly straight again, we can make a meaningful difference, especially when treatment starts early and is well managed. With the right approach, scoliosis can often be improved, slowed, or partially corrected without surgery. The key is personalization. No two curves or patients are exactly alike. At ScoliCare, we focus on helping people manage scoliosis confidently using custom bracing, guided rehab, and a clear plan tailored to each individual. That's it for now, but there are many other resources on our channel if you're interested in learning more. I'm Dr. Juan du Plessis, and from all of us at ScoliCare, thanks for watching.